This week we're going to focus on strategic planning for organizations, as well as the first few parts of strategic communications planning. So what is strategic planning anyway? Historically speaking, strategic planning is an ancient science of warfare. Strategy, as we know it, began on the battlefield where large-scale stratagems were used to confront and engage the enemy. The word strategy comes from the Greek word stratego, which means to plan the destruction of one's enemies through the effective use of resources. This morning we'll be talking about terms associated with strategic planning such as objective, mission, strength and weakness, all of which were developed or used initially by the military. In the modern day, strategic planning has been adopted as an administrative or management concept. According to John Bryson, strategic planning is based on the premise that leaders and managers of public and non-profit organizations must be effective strategists if their organizations are to fulfill their missions, to meet their mandates, and to satisfy constituents in the years ahead. Strategic planning has been used in the general business community since the mid-20th century. As you'll see in the reading by Zuckerman, he says that healthcare organizations have been using strategic planning principles since the 70s, orienting towards a service provision and meeting the needs of the population. But why is it important to plan? Is it possible to really plan for the longer term? Can ad hoc planning be as effective? There are some relative givens in healthcare. Funding is never going to be enough. Patients are going to continue to age, and staff are going to have to deal with more with less. Most importantly, employees recognize what's in it for them when you do your planning. There's a more secure future with an organization that plans well. So what are some of the benefits of strategic planning? Strategic planning provides focus, a roadmap or direction. It lays out where it wants to go and what it's going to need to get there. Then each part of the organization is made aware of its role and is able to align the priorities so that they can contribute to heading in the right direction, helping provide momentum for success. Strategic planning sets priorities for crucial strategic tasks, including the wicked or really important issues such as being forced to do more with less, addressing the growing complexity of healthcare, and more. It provides members of the organization with areas for improvement that they can really sink their teeth into. Strategic planning also helps determine where the organization's precious human and financial resources should be focused to ensure growth and change to the programs and activities with the highest potential payoff. Strategic planning establishes measures of success so that progress can be measured and gauged. It means that staff members know where they stand, and that's a fundamental business and human need. Accountability and responsibility are also generated as all parts of the organization know what's required of them to achieve success. When all is said and done, employees recognize what's in it for them personally. They have the resources to do what they want if they plan. They have a more secure future if the organization plans well and is successful. And there's recognition by their peers and superiors when they succeed. So we're going to walk quickly through the steps in corporate strategic planning. If you're interested in more information about this form of planning, check out the Zuckerman reading that's linked from the resources in our Blackboard forum. There are many models for strategic planning purposes, and most of them have the following 5 features. We're going to walk through these fairly quickly before we get into strategic communication planning, which is very similar. But many of you may also already be involved in strategic or big picture planning for your organizations. As managers and leaders, it's pretty much a given that you'll be consulted or involved in this kind of activity. At the center of the activity is your organization's mission and vision statements. In a nutshell, a mission statement is about what you do, and the vision is about what you want to be in the future. These are key building blocks for brand development within your organization. A vision statement defines your organization's optimal desired state. It delivers a mental picture of what the organization wants to achieve over time. Think of it as your North Star, Every employee should understand their work every day and how it ultimately contributes to accomplishing the vision over the longer term. There are some really good vision statements out there and some really bad ones. A well-written one, for example, is the Alzheimer's Association. Our vision is a world without Alzheimer's disease. The mission statement should define the present state or purpose of an organization. It's typically renewed every 2 to 3 years and is something that all employees should be able to articulate. An example of a great mission statement is from the Frontenac County Mental Health and Addiction Services. It says, Frontenac Community Mental Health and Addiction Services, a nonprofit corporation, provides support services for people with mental illness, drug or alcohol use, and/or problem gambling, and their families. As our North Star guides, the vision and mission are central to the strategic planning process. The environmental scanning process is the first step in the process. This is where data is gathered and numbers are crunched. The goal is to determine which external forces might affect the organization in the future and what factors may need to be addressed in order to deal with these potential challenges. This information is then assessed to determine where the organization should be going. Is it the current mission and vision statements still relevant? Do they need to change? The next step, strategy formulation, helps establish goals, objectives, and major initiatives for the organization. Strategy implementation involves identifying the actions needed to implement the plan and put it into action. Finally, the success of the implementation of the strategy needs to be measured regularly. Once complete, these plans are communicated far and wide, and in our healthcare world, they're typically posted on the websites of our healthcare providers. If you ever wonder exactly what a healthcare organization that's funded through the Ontario provincial government does, visit their website and look under the About Us tab. There you will find a lot of strategic information, including the strategic plans of the organizations, the missions, the visions, the values, and a lot more information.